Hello, everyone. So this month we've been talking about how to improve our health in general, and we've talked about preventative care to common mistakes people make with their health and how to avoid them. And today I want to focus on something that often gets minimized or overlooked, and that's our mental health, specifically anxiety. And I see many people who struggle with anxiety. And what's interesting is most of them have been dealing with it on their own for years without seeking any kind of help. But our mental health can deeply affect our physical health. And that's what we're going to be talking about today. I'm Dr. Lola Shaye. I'm a board certified family and lifestyle medicine physician with special training in menopause care and founder of InTouch Primary Care. And at InTouch, we've created a whole new way of providing primary care based on membership and wellness rather than worry, hidden costs, and the inflexibility that often comes with insurance. So, what we do is we help busy people stop waiting for a crisis and start building real health through personalized, proactive care. So, in fact, um, going back to talking about anxiety, and I do see a lot of people in my practice that have anxiety, and many of those that I see don't come in saying, "Oh, I have anxiety." They come in because they have symptoms like palpitations, lightheadedness, headaches, shakiness, abdominal pain, back pain, neck pain, trouble sleeping, or sometimes they just don't feel like themselves. They don't feel well. So I had a patient who had anxiety, and for a long time he didn't want to address it. And when he finally decided to address it, um, it made such a big difference. So he had had abdominal pain for years, and he had had CT scans, he had seen specialists and all kinds of tests. And one day we talked about it, and when he had come to the point where it was truly affecting his life, and it had been affecting his life, but he had decided to do something about it. And once he started treatment, he felt so much better. It made a huge difference. So oftentimes, when I see people with anxiety, I can tell right away that at least some of the symptoms that they're mentioning are likely related to anxiety. However, we will still go through the process to make sure that there are no other things like, thyroid disease, anemia, may have to do some heart tests, just make sure nothing else is being missed. And then once we've confirmed his anxiety, the next question is, now what? What do we do about it? And so I'm going to take you step by step, evidence-based methods for managing and treating anxiety. So the first step, which is important for anyone who is experiencing anxiety, that can be very helpful, and and I'm not saying this lightly, it's what we eat, how we sleep, and how we move. And that can powerfully impact anxiety. For example, caffeine and alcohol can both worsen anxiety symptoms. We've had research in journals like JAMA, Psychiatry, the New England Journal of Medicine, that have shown that caffeine stimulates the central nervous system. It increases the heart rate and alertness, which can feel like anxiety itself. So it makes anxiety feel worse. Alcohol, on the other hand, may seem calming at first, but it often disrupts sleep. It triggers rebound anxiety the next day. But there are ways to make this better. Exercise, for instance, is one of the most effective and natural treatments for anxiety. According to the American College of Lifestyle Medicine, regular physical activity significantly reduces symptoms of both anxiety and depression, often with results comparable to medication, especially in mild cases. So I had a patient who experienced this real life, had anxiety, had it for years, was on medication as well, but still had symptoms and embraced exercise in treatment of his anxiety. And it has made a phenomenal difference in his health. Not only did he lower his weight, which was one of his goals, he was also able to lower his anxiety and he feels great. So anxiety and exercise can be a powerful way to lower symptoms of anxiety. And then there's sleep. Prioritizing restful sleep can make a major difference. For some, anxiety will make it difficult for them to sleep, but for others, they can sleep, but they choose to sleep later than they should, and so that lack of sleep worsens anxiety. So, if there's a problem with sleep, sometimes we need to address the anxiety more directly first before addressing sleep. But if there isn't, those that can sleep take full advantage of getting restful sleep. Also, adding mindfulness, yoga, or even short moments of like meditation can calm the body's stress response and retrain how we process emotions. So, prayer is also huge in helping people through anxiety. So, if you're in Texas, and you want to learn practical ways to manage stress, anxiety through lifestyle medicine, I invite you to schedule a free 15-minute consultation. We'll talk about your symptoms and create a realistic plan to help you feel better. And we'll do this step by step. So that's with lifestyle medicine. And like I said, I've had patients be very successful with lifestyle changes in managing anxiety. Now, then step two, I'll call it, is, lifestyle changes are powerful, but sometimes they're not enough, and that's okay. Think about anxiety like it's a condition, it's a medical condition. It's not a feeling. It's like think about it like an infection. So if you catch a simple cold, for instance, rest and hydration may be enough. But if you develop pneumonia, you're going to need more than tea and rest. You may need antibiotics. You might even need to be seen in the hospital for care. And then, depending on the severity, some people even end up in the ICU. So, think about it like that. With anxiety, there's severity, depends, right? Everyone needs basics, good rest, movement, nutrition, but there's some that would need additional treatment. And that's where things that I'm going to talk about will come in. So, the first thing that I would highly recommend that people consider, and of course, with all the recommendations I make, please check with your own doctor and confirm that this will work for you. So, they're counselors, they're therapists, they're psychologists, they're psychiatrists, and sometimes people get confused in terms of knowing who they can see. The key is not just about the title, but it's about whether they're using evidence-based methods for anxiety. So the gold standard is something called cognitive behavioral therapy, and multiple studies, including landmark meta-analysis in JAMA and psychiatry, have confirmed that CBT, cognitive behavioral therapy, is one of the most effective treatments for anxiety disorders. So this is not just about sitting with someone and talking about your problems or just getting advice. It's a structured, science-backed process that helps you identify unhelpful thought patterns and it retrains your brain's response to stress. So the good news is there are actually now even internet-based and mobile CBT programs that have been shown to be as effective as in-person session. So that means that you have access more than ever. So take full advantage of these types of treatments. So if you've been dealing with anxiety, you don't know where to start, you can reach out to a licensed therapist, psychologist, counselor, or explore CBT programs online. And if you need help identifying reliable evidence-based options, go ahead and schedule with us free 15-minute consult. We'll share practical next steps and help you, schedule appointments so that we can help you with your questions. Okay. So, medications, right? So now let's say you have made healthy changes, you've tried therapy, and you're still struggling. And this is where sometimes medications may come in, right? And again, I know people hesitate when it comes to medications, especially for conditions like anxiety. And the hesitation is understandable, but let's go back to the pneumonia analogy, right? So remember, if someone has pneumonia, if they refuse treatment, it's not that pneumonia cannot get better on its own. It could, although it could also get worse, but it could get better eventually, much slower, but it could also cause permanent lung damage in the process of getting better when it's not treated properly. In the same way, untreated chronic anxiety can actually cause structural and chemical changes in the brain that affect memory, emotion, and focus. So we know now that neuroimaging studies show that chronic anxiety is linked to changes in the brain regions like the amygdala, the hippocampus, the prefrontal cortex. These are areas that control emotion and decision making. And these changes are reversible. And that's what both therapy and medication help to do. They actually normalize brain chemistry and restore balance. So, despite best efforts with lifestyle and therapy, medications may be necessary. It may be a necessary part of recovery, and that is okay. So, with personalized care, you can discuss options, you can adjust doses safely, and even do genetic testing to identify what medications may work best for you. So, there are even newer treatments like transcranial magnetic stimulation, TMS, or transcranial direct current stimulation, TDCS, that usually done by psychiatrists that could be also helpful. But the point is, you don't have to live with pneumonia. You don't have to live with untreated anxiety. There are things that can be done, from natural lifestyle behaviors to therapy to medications, but don't ignore it because it truly does impact your physical health, and it actually can impact your mental health. Well, it impacts your mental health, but it can impact your mental health more seriously over time. So if you've been struggling with anxiety or physical symptoms that may be linked to stress, don't wait. Schedule your free 15-minute consultation. If you're in the Texas area, we can talk about it, and we can talk about if the options that we have will fit for you. So imagine if anxiety was manageable, that your sleep has improved, your focus has returned, your body finally felt calm again. Imagine understanding exactly what's happening in your brain, knowing that there are practical, proven steps to heal it. So anxiety doesn't have to define your life. There are tools, there are treatments, there are lifestyle changes that can make all the difference. So I hope this helps, people feel more informed and hopeful about what is possible. And if you have found this helpful, please go ahead and like, share, subscribe, because it helps more people discover information that can change their health for the better. I'm Dr. Lola Ashaye. Thank you for watching. Remember, your mental and physical health are deeply connected, so you want to take care of both of them so that you can thrive.